Overall, the European report showed that much progress has been made with health in Europe, over the last decades in fact. But this progress really came at a price, and that is the other finding we have. Progress has not been uniform across the region, and therefore inequalities, as we call them, differences between men and women, countries and population groups, are really the hallmark now of European statistics. So there is no room for complacency, although of course we have made progress. People in the European region live longer. In fact, they live a lot longer. In the last 30 years alone, life expectancy has increased by 5 years for both sexes combined. In men and women, though, there are differences. In 2010, women lived on average to the age of 80, while men only lived to the age of 72.5 years. So that's quite a difference. But this difference is even bigger in some countries. In some countries of Eastern Europe, for example, women live up to 12 years longer than men. And that is, of course, also a result of lifestyle choices that men make, like increased smoking, alcohol misuse, etc. So we have inequalities again in the most basic of our indicators, which is life expectancy. The European population has aged considerably in the last few decades, and of course that is a huge achievement and we should celebrate that. We should not label that a problem, we should be mindful of it. Because what's the alternative? That would be premature death, and of course that's no alternative at all. So the population of Europe is fairly old. 15% of the population are over the age of 65. And so out of the 900 million people we have today, we will probably have 900 million people in the years to come because fertility rates have also fallen. That means the overall numbers will remain fairly stable. But it will mean that the population will grow older. And we assume that by 2050, about a quarter of the population will be age 65 and above. But there are other demographic changes that are very interesting and that we observe in the report. For example, 70% of us live in urban areas. That wasn't always the case. It's only recently that more people live in cities than in rural areas. And so in Europe, this trend is very obvious. But also migration has increased. 73 million European citizens are migrants. That's 8% of the total population. The majority of those, interesting, are women. And they're younger. They're also poorer though, and that means they may have more health problems. And so the Europeans need to be mindful of that, particularly when it comes to health policies and social policies. Well, the report makes it very clear that non-communicable diseases such as heart disease, stroke, cancers, respiratory diseases are really the super killer in Europe. 80% of deaths are caused by these, what used to be called chronic diseases. And unfortunately, 30% of those deaths are in fairly young people in Europe, in those under 65, what we call premature deaths. And when you look at this age group specifically, you find that half of them are actually from circulatory disease, which is heart disease, stroke and high blood pressure. And 20% are in cancers. So we really are looking at the full peak of what we would call a non-communicable disease epidemic in Europe. Of course, these non-communicable diseases are closely linked to certain risk factors. And in the European region, we are unfortunate to have some high rates of risk factors, including smoking. Still 27% of over 15-year-olds smoke in Europe. We have alcohol misuse, especially in the eastern part of the region. And we have environmental hazards, such as air pollution. And in some parts of the region, air pollution shaves off about 8 months of life of a healthy person. That, of course, is a shameful statistic and something that we can actually tackle. Risk factors are modifiable, and so non-communicable diseases can in part be prevented by working on these risk factors. And of course, we must do that in Europe. I called the non-communicable diseases the super killer in Europe, but we must not forget about communicable infectious diseases. These still kill people in Europe, and in fact the European region is the only region in the world where the HIV epidemic is still rising. That is a terrible statistic. We are also one of the regions that are struggling with resistant tuberculosis, multi-drug resistant tuberculosis. And 40% of all deaths from communicable diseases are in fact from tuberculosis. We have observed that over the last 20 years, the mortality from communicable diseases in Europe has actually increased. This should not be the case, but clearly we are observing this and we must be mindful of this. And this is very much compounded by the problem that we call antimicrobial resistance. What this means is that certain bacteria and viruses and parasites are resistant to the drug that we're using to treat them. Now, when you have that situation, of course, mortality from these diseases increases. And this problem of AMR is very acute in Europe. So we must be careful not to lose the weapons we have created to fight these diseases. And this is also one reason why we see this increase of mortality in these particular diseases in Europe. The report is issued every 3 to 4 years, so it is in a way one of our flagship publications. And the analysis is based on health information that we receive from member states, that we as an office analyze and then discuss with our countries. Health information is really vital. You might say, well, you would say that this is the area you work in. But actually, I think it is very fair to say that health information is the backbone of health policy. What doesn't get measured doesn't get done. So it is really important to track progress, to monitor progress, to be accountable to our citizens and our constituents, which are our member states, in the reporting of health. Our health data are fully available online. One of the big databases that we have is the Health for All database. And everybody knows about it, and you can interrogate it online with all the indicators therein. But also we believe that we need to go further. The European member states adopted a policy last year, the Health 2020 policy. And in that policy, they marked 6 overarching goals or targets for progress. So these targets now need to be tracked and monitored. And one of these targets, very interestingly, is well-being, is to enhance the well-being of European populations. And you will say, well, isn't WHO going beyond its mandate with that? Not at all. The definition of health that WHO has used since 1948 includes well-being in its definition. It says that health is not merely the absence of disease, but the full physical, social and mental well-being. Now, for the last 65 years, we have reported on death, disease, disability, and done so fantastically. We're doing this well, but we have not reported on actual health or well-being. And we are really taking the lead now. Together with our partners, many agencies in Europe, including the European Commission, but also the OECD and our member states, we are now moving towards the measurement of well-being in the European region in order to measure whether we will meet the target. Now, obviously, this is something that is complex, but it is something that needs to be done because at the end of the day, all citizens value well-being. And when you look at surveys, they often report that one of the things they see as most important in well-being is health. And so we're measuring and tracking well-being in the context of health with our partners, and we hope that by 2020 we have made huge progress in the European region.